Welcome everyone joining us from Connecticut and from around the rest of this country to our new series of episodes that explore global issues and global ideas and keep you connected to the world. Today we are so pleased to have our senator from the state of Connecticut, Senator Chris Murphy, who's a member of the Foreign Relations Committee, who will be able to talk to us about what's happening in Washington, the priorities he's working on, and then hopefully give us a little tour of what's happening in the rest of the world. To set the scene, as we sit here today, over 796,000 people around the globe have been tested positive for COVID-19. Over 40,000 people have lost their lives, and the spread of the virus has spread to over 171 countries with over 1 billion people in quarantine and in lockdown. Senator, can you talk to us? Thank you so much for joining us today. He's been working nonstop, and we are so lucky to have him here. Can you tell us what is happening in Washington and what every American needs to know this morning?
Well, thank you very much, Megan, for having me here. Let's see, hopefully this is still working. My video froze, but I'll trust that you can all still hear me. Can you hear me, Megan?
Yep, you're great.
Okay, great. Thank you all for being on this call. Megan, thank you for inviting me. Thanks to the World Affairs Council for your leadership. I've been a frequent guest, and I always appreciate the audience. Listen, this is a crisis like none of us have seen before, and hopefully none of us in the United States will see again. We have failed to meet this moment at a federal level. The president has unfortunately left leadership to states and municipalities, mayors and governors who are stepping up at various levels of effectiveness. And all of us are indeed working 24/7 to try to make sure that our hospitals and our states, our municipalities, our first responders, our school districts have all of the resources that they need. We passed 3 different packages. The latest, of course, the biggest in size, $2 trillion, that includes major new resources for all of those entities that I just listed. We will likely have to come back and pass a 4th assistance package, probably in part to make amendments to the $2 trillion that we just passed, but also to take a look at new capacities as well. I hope some of you will take a look at a piece that I published just last night in Foreign Policy magazine. It's available online. The title of the piece is entitled, "The U.S. Government Must Prepare Now for the Next Pandemic." And the case that I make in that piece is that, pandemics and viruses don't operate according to our schedule. And while it is, never advisable when dealing with a virus of this lethality and this size and scope to try to think too far ahead, obviously our first priority has to be controlling its spread in the United States and saving the economy from catastrophe. We don't know whether we will sort of see the next pandemic hit our shores in 2 months, 6 months, 12 months, or 3 years. And what we certainly know is that we weren't ready for coronavirus. And we've got to be having a conversation about how to rebuild our global public health platform so that we learn from these mistakes. And I'm hopeful to try to lead that conversation. I sit at a really interesting intersection of committees in the Senate. I think I'm the only member of the Senate, at least certainly the only Democrat in the Senate, who sits on the Foreign Relations Committee, which obviously oversees American foreign policy, the Appropriations Committee, which writes the checks for all of our programs, domestic and foreign, and the Health Committee, which oversees domestic health policy. And so I understand that our priority and my priority is keeping Americans safe right now. But if we don't also have this conversation about rebuilding our global public health infrastructure, then we're going to be right back in the same place much sooner than any of us would like. And so hopefully as part of this conversation today, we can talk about both the immediate response, but also the rebuilding of America's international health infrastructure that I think is a very necessary conversation to have right now.
So that leads me to a question. I'm going to combine a few questions that have just come in about the Defense Production Act and how in the future we might mitigate some of these shortages that we are experiencing now and about to experience when we're looking at supply chains, including pharmaceuticals.
Yeah, so I've been a leader in pressuring the administration to use its full emergency powers, both to compel the manufacture of critical medical supplies, but also to control the distribution. Our problem is twofold. One, we don't have enough masks and tests and reagents. I just got off the phone with the CEO of LabCorp, one of the two biggest testing companies in the country, and they literally on a daily basis are piecing together the components necessary to keep doing every single day. They don't know whether they're going to have the components necessary to do the tests. And it is a race to just keep the supply chain coming. So we have a shortage of equipment, but we also have a misdistribution of resources. Product flows to where folks will pay the most. And the private sector distribution of all of the equipment that we need incentivizes both gouging and hoarding. And so you need the federal government to step in and do both, compel more manufacturing, and then guide product to where it is needed the most. We also, as you referenced, have international supply chains that we are very dependent on. And so Senator Rubio and I have introduced legislation that would start immediately the process of making some decisions about what capacities we need to have domestically and what maybe we can handle the risk of being international. Let's just think about three of the most important pieces of equipment necessary to handle this response. The machines that the big labs use to test the swabs are made in Switzerland. The swabs themselves are primarily sourced out of Italy. The reagent necessary to do the tests is a European product, much of it coming from Germany. Now, those are European suppliers, but European suppliers that are compromised in part right now because of the spread of coronavirus there, but also European suppliers that are not particularly excited to help the United States amidst a foreign policy in which the president is regularly attacking the European Union and our European partners. And so foreign policy matters right now because when the president is announcing travel bans without telling any of our European partners ahead of time, it certainly chills Europe's interest in splitting the reagent supply between their domestic uses and U.S. demand. And so it is a big conversation that has to be had about how you compel production, how you prioritize distribution, how you eventually bring back more sourcing to the United States, but then how you also manage our relationships with other countries today to make sure that we have a flow of product from foreign countries that make a lot of the things that we need.
So let's take that from what you just said and look at global cooperation or lack thereof over a coronavirus response and what global cooperation could look like in recovery. And what does that mean for American leadership and foreign policy?
Well, I mean, let's just take a couple examples, and I wrote about these in my piece in Foreign Policy. First, let's talk about something called the International Health Regulations. And very few people know that these exist, but these are a set of health regulations which regulate how countries deal with each other when it comes to instances of pandemic. There are 194 countries that have signed on to those regulations, but they haven't been updated in about 5 years. And to a certain extent, they're pretty feckless, given that the United States has not spent a lot of time in trying to get other countries to implement and enforce those regulations. Those regulations need to be updated, and they need to be updated with a view to the mistakes that were made in China, right? We all, as a global community, lost a month as China at first treated coronavirus as a national secret. Eventually, they started sharing information that allowed the world to start to build tests, vaccines, and treatments. But the IHR could be a vehicle, if the U.S. showed leadership in reforming those regulations, to compel countries to share information earlier. So that's one opportunity. Second is the PREDICT program. The PREDICT program is a U.S.-led effort that President Trump stood down that collected virus and pathogen samples all around the world so that we sort of got information as early as possible. President Trump, I believe, eliminated that program. We need to stand it back up and supersize it so that the United States is out there picking up the first signs of problematic viruses. And then I won't sort of go into detail now, but preview a bigger conversation we have to have about the size of America's public health infrastructure. We need to have a global health security challenge fund where we're partnering with other nations to help them build up their public health systems. Remember, America's health security is only as strong as the weakest country's public health infrastructure. We have to have far more personnel out there across the globe. Frankly, if we had a bigger public health footprint in China, if we had sort of taken the time to try to integrate ourselves more with China's public health infrastructure, then maybe they wouldn't have kept all of this a secret from us. That's just, a preview of some of the endeavors that we can start right now to protect ourselves the next time this hits.
So as we look around the globe and how the coronavirus and COVID-19 epidemic is impacting other countries, one of the things that you've written on is about the easing of sanctions, in particular what's happening in Iran and in Venezuela. Can you talk about, what are some actions that we could take that might help ease suffering in those places?
Sure. I led a group of senators about a week ago, although I sort of have no concept of time any longer. So I say a week ago, and it's very possible that this letter could have been 2 days ago. I led a group of senators sending a letter to Secretary Pompeo and the administration asking them to adjust their sanctions, and this was specific to Iran and Venezuela, to allow in additional relief supplies and medical supplies. There's just a bunch of articles in European papers this morning about how France and Britain have begun to send medical supplies to Iran, potentially in violation of U.S. sanctions, but they just have decided they can't wait, and they're going to essentially test our willingness to penalize countries or companies for trying to keep people alive in Iran. And listen, I think we have a moral obligation, first and foremost, to not effectuate U.S. policy that leads to the death of innocent people abroad. But we also have to understand that our ability to try to nuance Iranian politics in the direction of a future regime that is going to end support for terrorist groups is dependent on a sizable chunk of the Iranian people still having good feelings about the United States. Young people in Iran have an open mind about the United States and would be willing in the future potentially to support a regime that oriented itself in a different way towards us and our interests. That window of opportunity is eliminated if the United States is not just sanctioning the country economically, but is doing it in a way that leads to the death of thousands or tens of thousands or hundreds of thousands of Iranians. And so from a national security standpoint, it doesn't make any sense to have a sanctions policy that prevents medical supplies from getting into countries that are adversaries to us. But from a moral standpoint, first and foremost, I think it's an imperative for us to adjust our sanctions. I hope the administration listens.
So this crisis is impacting the most vulnerable in very important ways. We have a question that just came in wanting to understand if the U.S. is willing to do anything for refugees that are spread out through the world. What's happening there?
So the UN is releasing a call for a new global fund to support refugee populations in the face of this epidemic. We obviously have to dramatically upscale the public health supports around refugee populations, both those that are in congregate settings, but also those that are spread out in places like Lebanon, for instance. What I have recommended is that the United States make a commitment to fund at least 1/4 of that UN public call. And I don't know whether this letter has been released or not, but I've written a letter and I'm asking colleagues to join, again, calling on the administration to put up 1/4 of those dollars. And I don't have the numbers in front of me right now, but we need to show both financial and moral leadership right now. And, this is in a context in which the United States has effectively shut down refugee flows into our country. It stands to reason that if we aren't willing to take refugees here, which I think is a security and moral abomination, then we should be willing to support them abroad. And so that is, I think, a step that the administration should take, and there'll be a group of us, I hope, calling on them to do that shortly.
So as countries go through crisis, some of the things that we're seeing happening around the world are governments instituting emergency powers. So we saw Vladimir Putin doing some interesting things in Russia last week and Viktor Orban in Hungary. Can you talk about how that might lead to, what's happening in those countries?
The actions you're referring to stand on top of a very troubling slide away from open participatory democracy to much more closed and autocratic systems. There are plenty of other examples of where similar trend lines exist. And so this public health epidemic provides an excuse for would-be autocrats to sort of move that transition faster. And listen, of course, we worry in the United States that some of the capacities that the federal government might stand up here that could be temporary in nature could also stay with us even as this crisis passes. It just underscores why the United States has to recommit itself to democracy promotion and advocacy for human rights and civil liberties abroad. I've been a longtime advocate that this administration should do more to push back on folks like President Duterte or Viktor Orban, who are starting to clamp down on participatory democracy in their country. And I argue that any future Democratic president has to make it a tenet of their foreign policy as well, not based on simple altruism, but because these countries that are slipping away from democracy, also tend to become security risks to the United States as well. And so we have to sort of recognize that while this problem may be exacerbated in certain countries during this crisis, it is a broader worry that has to be addressed by the United States standing up new pro-democracy capacity. One of the things that I care a lot about is countering propaganda overseas and allowing for independent, objective journalist sources to be able to sort out truth from fiction in general, but that is particularly important at this time. And so the Senator Portman and I have set up a capacity inside the State Department that does that, is beginning to get funded at a serious level. That kind of anti-propaganda capacity is more important now than ever.
So as we're all focusing on the coronavirus crisis, does this leave our national security vulnerable in any other areas? Are we afraid of increased terrorist threats, cyber attack threats? How is this impacting national security in other areas?
Well, I'll just give you one example. We were successful in this last appropriations bill to convince our Republican colleagues to invest a second round of funding in election security. It was a tough fight. Senator McConnell has generally been predisposed against any federal funding of election security measures, but we were able to put some more money in this last appropriations bill. And yesterday, Connecticut just got $5.4 million that will help us make further investments to protect our election system and our voter file against attacks. And I think we all certainly need to be worried about the fact that as other nations see us rightly self-obsessed with the public health crisis, they will perceive us to be distracted from some of our other measures to keep our country safe. And with a history-making election about to occur, it certainly is predicted, like China or North Korea or Iran or non-state actors would maybe ramp up their efforts to try to probe at our voter files, to try to sort of turn up their propaganda efforts on social media, thinking that we will be distracted from our election security efforts. We can't allow that to happen, and that's why it's good news that states all across the country just got an infusion of funding for election security purposes yesterday. We've got to stay vigilant and make sure that at the federal level, the Department of Homeland Security, DOJ, FBI, all the folks that are working to protect our elections from outside interference are still making that a priority.
Fantastic. Someone wants to know, how do you view this impacting our trade relationship with China that has already been strained, already under pressure?
Yeah, one of the tragedies, one of the many tragedies of Trump's disastrous foreign policy is that his relationship with China is one track, right? This administration is able to deal with China on only one issue, and that is trade. And those negotiations have been an utter disaster. We have lost potentially 300,000 jobs in the United States because of a nonsensical trade war that ended up with a deal that committed China to make absolutely no structural reforms that ultimately will end up costing the American economy even more money than had the trade war and trade deal not existed in the first place. But the inability to talk to China about anything else has put us in the position we are today. If, for instance, we had been able to be working with Chinese public health authorities early on during this crisis, maybe they would have been willing to share more information with us. But because we have this just unnecessarily antagonistic relationship with the Chinese based upon our inability to have a meaningful and productive trade conversation with them, it makes every other part of our relationship either non-existent or dysfunctional, which may have contributed to the fact that China was unwilling to talk to us early on about this pathogen. The next administration is going to have to rebuild a relationship with China in which you clearly are going to have antagonistic aspects to that relationship, but you have to be able to compartmentalize, as President Obama was able to do, other more functional sort of avenues for dialogue. President Obama had his grievances on trade with China, had his grievances on human rights, but he was able to make progress on climate. And so the next administration is going to have to figure out a way to create a functional pathway for conversation on the international public health regulations, for instance, with China, while continuing to fight on other issues.
So thank you very much, Senator Murphy. As we're looking across the world, what are some of the other priorities you're looking at? What should we as Americans be paying attention to, today and going into the future?
Well, that's a big question, obviously. I remain incredibly concerned about the president's policy in the Middle East. Nobody has sort of paid any attention to this, but over the course of the last month, we have seen a dramatic increase in the number of rocket attacks against U.S. forces in Iraq. We seem to have no ability to prevent Iranian-aligned and backed militias inside Iraq from attacking U.S. forces that have, almost no protection from these rocket attacks. We're in the process of sending in systems that might be able to offer that protection, but they're not there yet. And so there still is this risk that we could fall into a conventional military conflict with Iran because, we are simply lucky that the attack that immediately followed the assassination of General Soleimani didn't kill any Americans. The Iranians were intending to kill Americans, and had they ended up killing 100 American soldiers, we would likely be in a shooting war with Iran right now, involving the deployment of 1 million troops to the region. Well, the Iranian-backed militias are actively firing at U.S. troops. They have killed U.S. soldiers in the last month, but should they land in a U.S. base that kills 12 Americans or 36 Americans, we could be in the middle of a kinetic conflict with Iran. And so I think we have to pay close attention, and we have to continue to raise the specter with the administration so that they start talking to the Iranians. I got some heat from the administration for having a meeting with Foreign Minister Zarif in February. I think it's frankly a responsibility of members of Congress who have the ability to talk to the Iranian regime to do it. So we at least have some channel of dialogue that exists now is a means to try to prevent these crises. So that's certainly something that I still spend a lot of time worrying about. That's just one example.
Thank you so much. As our time is coming to a close today, what do you want to say to everybody listening? And what advice do you have for them in the weeks and the months ahead?
Well, listen, I mean, this is obviously a very unique threat to the security of the country. It is not a threat like a foreign army that can be met by a government-led response alone. The only way to be able to turn the corner on COVID-19 is for us all to take extraordinary measures that are deeply uncomfortable and often economically impactful and hurtful. And so I'm probably preaching to the choir, the group of people who would select to spend part of their day in a conversation about U.S. foreign policy related to the current public health crisis. But it's just worth saying again that you have to comply with your governor's orders. You have to stay home in order to stay safe, and you have to encourage other loved ones to do the same. And then I hope that you all will speak up at this moment as individuals that are interested in America's place in the world. In my foreign policy piece, I make this case that you have to walk and chew gum at the same time today, that you have to be in a conversation right now about starting to stand up our international public health infrastructure. And I would argue that the next emergency supplemental bill is a place that we may look to do that. We put about $1 billion in the first emergency relief package into foreign-facing, international-facing infrastructure. That's not enough. It's not close to enough. And so, well, I don't want to be in a position long-term where it's only emergency relief packages that are our means of funding international public health staff. I also think that we shouldn't let this opportunity go by without at least pre-funding some of those capacities. For instance, the PREDICT program, that program collects pathogens and viruses and does early research. We could fund that for 10 years in the next emergency relief package that Congress considers. And I really am going to need your help to demand that if we come back and do another relief package, that it have an international facing component to it. That is the responsible thing to do. Maybe not with respect to our current effort, which is very domestic facing, but to make sure that we're not going through this again in the short term.
Senator Murphy, thank you so much for joining us today. And I look forward to the time where we can welcome you to the World Affairs Council in person. And I wish your families, stay safe and well. And thank you everyone for joining us. You stay safe and well, and we'll see you next time.